Welcome to Innovating Clinical Trials, the podcast designed for clinical research professionals eager to deepen their understanding of clinical trials through concise, insightful segments. Join your hosts, Eves and Ted Trafford, as they uncover the core issues in clinical research, reflect on the industry, and challenge conventional wisdom.
Ted, it's been a while. How are we, sir?
Liam, I'm doing great. How are you?
I am so good, so excited for season 2 and all the amazing guests and topics we're going to be talking about.
I know it's going to be a lot of fun. I've missed this and really excited to get back into it. The days are getting shorter in fall, and it's dark at this time of the day, my time. So
well, it is early for you.
hopefully I sound awake.
You sound very awake considering it's 7 o'clock in the morning there now.
Yeah, it is. Yeah, but that's all right. Listen, just along the theme of, celebrating season 2, I think for our first episode, we should maybe go out to dinner and celebrate or something like that.
That to me sounds wonderful.
All right, let's dive in.
So, sir, you've got a really interesting topic for us today. Do you want to tell us a bit about it?
Yeah, absolutely. So it's really interesting because the whole concept of, sponsors wanting to be, sponsor of choice. And it's something that I'm hearing more and more about lately in my conversations with sponsors. And I'm excited to hear that. They want to be sponsor of choice for the sites that they work with. And so I was thinking about that topic, and I was thinking about the whole concept of sponsors getting feedback from sites on how the study's going or how the study went. And most sponsors don't actually solicit any kind of site feedback on their studies, which is strange to me. And the sponsors that do, they'll send a survey at the end of the study. And, that's really too late. Sites won't remember the things that went well or went poorly a year ago or, 18 months, 3 years ago. And so then, I kind of stepped back and was thinking, well, what's the most critical time point in the study, really? Is it startup? Is it when sites get the green light to go? Is it data lock? And I didn't think any of those were actually, if you think about momentum in a clinical trial and really, successful enrollment periods and recruitment in studies, I don't think it's any of those three. And I happened to actually go out for dinner the other night, and one of my favorite restaurants, it's this tiny little Italian place. It's in this little strip mall, and the place is dimly lit. The tables are so squished together, you feel like you're almost right on top of the people that are next to you. But here's the thing: the number one, the staff is amazing. So they've got just that perfect mix of being welcoming and attentive, but not over the top. And the food is just fantastic. So my favorite dish is something called Pollo Tuscany. It's this chicken dish with pasta, sun-dried tomatoes, mushrooms, and a white wine cream sauce. And what happens at the restaurant is, the server will bring the entrees to the table. And after making sure that we've got everything we need, they leave. And about 5 minutes later, they reappear and ask a simple question: is everything to your liking? And for me, that's the sweet spot. If they ask at the end of the meal, it's too late to fix anything, that may not have been to the customer satisfaction. And I think it's the same in clinical trials. And so then I started thinking about, what's the sweet spot? If a sponsor wants site feedback, what's the best time to ask? And I think it's not at the end of the study. I think the sweet spot is just after a site has enrolled their second or third participant. And, right around that point, I think a decision is made by the site. And whether it's a conscious decision or an unconscious decision, the decision is, whether they're going to dive into the study full force and keep enrolling, or whether they're going to pull back because there's maybe some things that are causing them concern. And that's really when you want to collect feedback. The startup's fresh in the site's mind, and they've had an experience with a few visits.
Yeah. I love that, because part of the problem, right, is that that's when a site is really going to invest, as you say, their effort and time is once they've gone through the process once. I think that's I love the analogy as always, but I think there's a question for me is like, how about there's certain things that we'll see as part of as operators. There's certain things we'll see when we open a protocol, right? We open a protocol as operators and go, well, that's not going to work.
Yeah.
I wonder whether there's like is feedback the question, I guess. And as for you, is feedback a one and done thing, or is it more
Oh,
like
yeah.
a skill of improvement?
Yeah, I think it needs to be, feedback needs to be a conversation that actually happens, throughout the trial, even long before the trial starts. And there needs to be mechanisms on how to capture that feedback, because often sites will provide feedback, but I don't know that it always gets through to the sponsor, and whether or not the sponsor has a mechanism to capture that feedback and escalate it and realize that, hey, we've got a significant issue on our hands. We've got a problem with one of the vendors we've got to fix. And how that gets communicated, how that gets identified as being a significant issue, and then how a sponsor and CRO can actually act on that.
Yeah. I mean, it's that iterative process, isn't it? Because I think that when we try and run the perfect experiment, and there's so many issues that will inherently crop up, talking more from an operational perspective, in which that you want to iterate where you can as fast as you possibly can to optimize the delivery of said. So it should be a case of this feedback that comes in, and that feedback is then shared right as fast as humanly possible across the system of other sites. If you've got sites that are finding issues on foot, then how do you make those changes and communicate that widely throughout the ecosystem of sites to optimize, which is probably I wonder if it's that said that is the problem. It's like, yes, feedback is so important, but it's how we make those changes quickly and give information out to the system as a whole that's the hard thing. Do you have any thoughts on that?
Yeah, I think that's a great point. And I think that we always think of feedback as being, qualitative in a lot of cases. So a site is struggling with it. It could be, who knows, lab supplies. Maybe they're not getting the lab supplies that they need, and we always think of it as being, you get this feedback that's qualitative, that, oh, site X is upset because they don't have lab supplies. Let's get lab supplies out to them as quickly as possible. But I wonder if there is a way that we could actually quantify the impacts that some of these things might have on site motivation, and say that, this type of an issue is given this type of rating, and that means something as far as the impact that it's going to have. And I know that it'd be perhaps complicated to set up, but I think that the impact that these things have on studies actually can be quantified. So, for example, I use the example of actively trying to collect feedback after sites have enrolled their second or third participant. And I suspect that we could do an analysis of recruitment in some of these big studies and see what the recruitment rates are and how quickly sites recruit those first couple of participants versus how quickly they recruit the subsequent participants in the study. And is there something that indicates that there may be issues in the study that need to be addressed based on the difference between these two, so that we could improve future studies? Sometimes it's not just about the study that's actively enrolling, but it may also be collecting data so that we could make future studies better. and both from the design and the execution. I don't know. What do you think about that?
Yeah, I think it's I love the idea of the sort of second and third order consequences of the feedback or information, should I say, because I think that if we can, as you say, if we can quantify some of these things, to simply say, oh, this thing is a particular problem at one site, it doesn't really get to the heart of the ripple effect that it can potentially cause, right? So we have this problem, we have problem X, but actually because of problem X, it impacts problem Y, and problem Y is a really big issue, right? And I think that if we can say, and maybe that's something for sites to think about, is that actually when you're giving feedback or, informing the CRO or sponsor about a particular trial, is to try and not just say there's an issue here, but there's an issue here. This is how we're trying to plug the gap, but just be aware that the second and third order consequences are significantly greater because this is going to impact this, and this, and therefore that's going to be problematic for the studies. So I think that anything that we can do to educate individuals about the downstream effects of some of the problems and to be able to, like you say, to quantify that, I think is a really good thing. So people are informed, right? And then at least it's done its job by informing it, and hopefully the group receiving the message can do something about a complex problem, though.
Yeah, because ultimately at the end of the day, we want to improve things, not just for the ongoing study, but conceivably for future studies. And if we actually take this approach that we're going to put the effort in to make things better, then hopefully we will start to improve the design and execution of some of these studies.
Awesome.
Thanks, Leo.
Thank you, sir. Appreciate your time. We'll speak soon.
Yeah, take care.
Bye.